Good morning, good day, good evening, good night, wherever you are on this planet we call Earth. Greetings, Earthlings and friends all over the world. So, welcome to my YouTube channel called Tell Us Recovery and Rehabilitation. My name is Ricky Carlson, and I started this YouTube channel yesterday. I used to post videos on Facebook, but for this particular matter here, I realized it's better with a YouTube channel so it becomes searchable for anybody in need of information. So this video log that I'm doing here is a video log about the recovery and rehabilitation after a ruptured biceps tendon on my right arm. So I'll give you the background. 8 days ago, I was at the gym working out. I was doing squats, and after that I had deadlifts. And as I did a maximum deadlift on about 500 pounds, I had the weight up, I was standing up, and my tendon snapped. And I felt it straight away because I've had the same injury on my left arm 7, 8 years ago. And I felt my biceps tendon ruptured. I let go of the weight and I went straight to the emergency room. They looked at it and they said, yep, your biceps tendon is ruptured. And they gave me a time for surgery, and the surgery was yesterday morning, Monday the 3rd. So this is the first morning after surgery, and I'll give you an update on the situation. Just a little more background on surgery. I came to the hospital at 7:10 yesterday morning. They took me in, prepared me for surgery, and the surgery was over in a couple of hours. They sedated me, they put me to sleep. It was lights out, and I woke up and the surgery was done. They also injected some form of anesthesia in my arm that numbed all my nerves in my arm. So I could not feel my arm at all, which was probably good after surgery. It's a bit awkward when you don't feel anything. It's like having a tooth numbed, at the dentist's office. You don't feel anything in your mouth. So that was a bit weird, but I got my feeling back at around 9 last night. And that's also when the pain came. So the surgery is, what they do with the surgery is, because your biceps tendon snaps from your arm, it redraws up into the upper arm. So your biceps pulls up with your tendon in your upper arm. So what they do is they pull the tendon down, they drill a hole in your arm where they attach a metal plate that they attached with some threads. They attach a tendon to that within your bone, so that when the bone heals, it closes up and your biceps tendon will be attached to your forearm again. This is a recovery that'll take months. The healing process will probably take a couple of months, and then rehabilitation takes another few months. I think last time I had this injury on my left arm, it took me somewhere around 6 to 12 months before I was back on track in a normal state. So we'll see what happens this time, because on top of the biceps tendon snapped, the rupture on the biceps tendon, I also had other injuries this time. I also ruptured parts of the biceps muscle, which caused a major bleeding in my arm. So my arm was swollen and very red. And this time I also had a lot of pain, pre-surgery pain. I didn't have that the last time, because when you snap your tendon, just the tendon and nothing else, you don't really have any pain. I didn't feel anything last time. It was just weird because my biceps was up in my arm. So, but when you tear your biceps muscle, there will be bleeding and there will be pain. So it was different. But it also is going to make the rehabilitation a bit different, because I also have to heal my biceps muscle, which heals itself. You don't have to do surgery on that because the muscle heals itself. You will have some scar tissue on your muscle though. So besides that, what's important, like the first week or so, or even longer than that, but I cannot use my arm at all. I cannot move my arm, especially not stretching my arm in any way. I can, as soon as I can start lifting my arm a bit just to move it, but I cannot stretch it, because there's always a risk that you will tear the tendon again, because it's just attached, so it's not healed yet. So It makes it a bit complicated because this is my right arm and I'm very right-handed. I'm not ambidextrous as my son is. I wish I was, but I'm not very good with my left hand. So everything becomes complicated. Anything from drinking, making food, doing anything is kind of complicated with my left arm. But obviously I get used to it eventually. So first day and first night, just an update here is that somewhere, like I told you, somewhere around 9 o'clock last night, the anesthesia in my arm wore off. I got my feeling back and the pain came back. And it was kind of, on a scale 1 to 10, I would say the pain was an 8. Somewhere around an 8 up to a 9 at times, because it really, really feels like you can really feel how they have drilled a hole in your bone in your forearm. It's a stabbing pain. It's a mauling pain. But of course, they prescribed pain medication for me. So, and as much as I don't like this type of medications, I will take them if I have to. So I have used these pain medications during the night to get some form of sleep, and I slept a couple of hours at the time before the medication started to wear off, and I had to get up and take new medication. So I guess the first day here and maybe the first couple of days is going to be a lot about pain management. And I am managing the pain with some medication, but I'm also using different meditation techniques because there are, meditation can always help your body. I wouldn't say that meditation would be enough in this form of situation, this trauma to your arm or this surgery, because it is actual bone pain and you gotta use medication too. But I use meditation so that I can relax. I will breathe deeper, I'll get my circulation going, and I will lower the stress hormones of my body, because stress hormones prolongs the recovery of any injury. So that's a good thing to think about, because it is a stress. Even though you don't feel it emotionally, it's a stress to your body and your system. You can feel how you start sweating, or you have your body is in some form of stress. So resting, eating healthy, drinking enough fluids. You can also take supplements like zinc, iron, B12, C vitamin is important. So take your vitamins, eat healthy, and get some rest the first day, and manage the pain. That's pretty much where I'm at right now. And the meditation also helps with acceptance, because there's no other way around this. I got to accept the situation as it is. I will not be able to use my arm for a while. I'll be on a sick leave from work for at least a month. And then it's a lot of rehabilitation training after that. You got to get your hand moving this way first. Then you got to start easily stretching your arm. And it's a very slow process, and it takes up to 6 months. So a good thing is to try to really early in this situation start to accept that situation. So you don't stress your body, or you don't stress the rehabilitation process, because that can cause more injury to your arm. So that's where I'm at right now. This is just a short update on the situation for my recovery from a ruptured, they say it's a distal biceps tendon rupture, which means it ruptures from the lower arm. You can also rupture your biceps tendon up at the shoulder, which is a different process. And I'm not talking about that. I'm talking about the distal biceps tendon rupture and the recovery from that. Other than that, I'll tell you that the meditation, besides helping with the pain and helping with acceptance, it really kind of relaxes me and calms me down, because it's not only the pain in your arm right now, it actually the uncomfortable position that you sleep in. I kind of half sat up all night. It's this thing that I have, around my neck, holding my arm up. It kind of put pressure to my neck. So all those things makes me, my neck hurts, my back hurts, my arm hurts. And but at this moment right now, I would say the pain is somewhere around a 4 or 5. It's manageable right now. Maybe the meditation helped, and I will soon take some more pain medication before it gets worse, because that's one of the things when you have pain of this type. If you wait until the pain is too severe, the medication won't really help. So you got to kind of, manage it. So that's what's going on in my life. Besides from that, it's a sunny day. Summer is here. I hope everybody else is doing good. I hope you have a good summer. I hope you have a great day. I hope you stay safe and healthy. There's still a pandemic going on around the world, so wash your hands, don't touch your face, keep social distance, use the face mask if you have to, and take care of each other. Show love and respect for each other, have patience with each other. It's been a stressful year. 2020 has been a stressful year in many ways, you know. Besides the pandemic, now I have this to go through. So I think in the future, I'm pretty much just going to scrap 2020 out of my calendar because it's been not the best of my years. But I'm trying to stay positive. I think that a positive mindset can always help. And, you know, I'll be back, like he said, you know, Arnold, I'll be back. So take care of each other. Have a nice day. I'm out. Boom.